What's up, DCI family? Happy Monday, August 16th. My name is Adam Peterson, account manager, South Chicago, Central Illinois. We got some good stuff for you. I know there's been some training calls out in the regions, but this is really important information. So I want to make sure you guys are fully up to speed. Before I get started, can everyone hear me okay? And can you see my screen?
Gotcha,
Yes,
loud
we're
and
good.
All right, so we're going to go over K Health training, and then we're going to talk about the Unlimited Plan Plus, right? So this was a big focus for us, the $60 plan. Months ago, we had great results. Now, as our focus has shifted, really pushing hard on the value-added services, the SDDNs, the EBBs. There's been a little bit of lost focus for this Unlimited Plan Plus, but it is again a priority for us in August. So briefly, what we're going to cover here, we're going to go over that new Unlimited Plan Plus because now you have K Health included. We're going to talk about some of the programs overall and the benefits, interacting with the AI, qualifying questions, your sales pitch, and then your app setup and next steps. And at the end of the call, there is a special offer for everyone on this call that you do not want to miss. All right, so let's get started with the Unlimited Plan Plus. So keep in mind when you're pitching that plan, right? Why do we sell the $60 plan versus the 50? If you happen to be in front of your computer screen, the biggest differentiating factor is that high definition video streaming. We are the only carrier that has high definition video streaming. It's really easy in your qualifying questions. Do you by chance watch Hulu, Netflix, Vudu, any streaming services on your phone? If the customer says yes, you should automatically be pitching them with the Unlimited Plus plan because that way you're going to get that high definition video streaming. And this slide here, you guys can feel free to copy it. The deck will be sent to all of your DCI account managers. They can share with you. But just to show the customers how much better that's going to look on a high definition screen if they are watching any streaming services on their phone versus that $50 plan with standard definition. In addition to that, you get 30 gigs of hotspot. So I know our EBB we're pushing hotspot, but on that $60 plan, you're getting 30 gigs of hotspot versus only 12 gigs on the $50 plan. So one of the best practices is in your pitch, you don't necessarily need to quote the price point right away. You can talk about, based on what you told me, if you watch any streaming services, Hulu, Vudu, Netflix, you want to go with our Unlimited Plus plan. If not, then go on our standard plan. So by saying the Unlimited Plus plan versus standard plan, it's automatically going to kind of plant a seed in their in the customer's mind. They're getting the most bang for their buck, the most value. If you do bundle, you can explain the breakdown, what you want to sell on the value. So when I'm talking to a customer, I'm going to be selling the Unlimited Plus plan versus our standard plan with unlimited talk, text, data, high definition video streaming, 30 gigs of hotspot, plus the big new differentiator, K Health, right? So Boost Mobile is now the only wireless company that gives you 24/7 access to a doctor. So yes, we have the high definition video streaming. That is a differentiator in the market. We now have K Health included on that $67 plan with unlimited talk, text, data, protection on your phone, high definition video streaming, 30 gigs of hotspot, and K Health included. Notice that when I do my bundle, I am bundling protection in there with that sale. The protection and the K Health is a huge, huge bonus that customers need to have on every sale. So a little bit about K Health, right? So if you haven't heard of it, they have over 10,000 five-star reviews. I know whenever I want to get something on Amazon or I'll get some ad targeted to me on Instagram, my wife's always like, check the reviews, make sure this is a trusted site, make sure this is what what they're selling you is legit. Well, this has over 10,000 five-star reviews. So this works and it is awesome. I've fully learned about the product now. I'm excited about having it for our customers. And you guys need to be excited about it as well and be able to transfer that enthusiasm to you people in your stores because this is a huge value, which they are getting for free on that Unlimited Plus plan. So the health information is safe with K Health. It's always secure. It's HIPAA compliant. So no worries about their information getting shared anywhere. This is just like going to a doctor. So let's talk about a little bit more about K Health. So what is it? It's going to be an application on your device that's going to give you 24/7 access to live doctors and health professionals. Even on a holiday, on Christmas, on New Year's Eve, on Easter, any holiday that's out there, this is available to you. You can get your questions answered, you can get prescriptions, you can get refills, and you can treat your health conditions. If you have children, ages 3 to 17, they are covered too right from your phone. Now, if they're newborns to 2 years old, obviously you want to consult your family physician, but ages 3 to 17 are covered right from your phone. What's really, really awesome about this, especially for our customers, right? A lot of our customers don't have insurance. Well, this is an app that does not require insurance. So you don't need insurance. You don't need to have appointments set. This is no problem. This is going to be amazing for our customer base. You're never going to have to worry about making an appointment or paying a deductible or sitting in an urgent care line. And it is free on the $60 plus plan, unlimited plus plan. So we don't have it in Hawaii, Alaska, or Puerto Rico. Unfortunately, not available in those markets currently, but everywhere else this is available. And yes, you can get it on the $50 plan. It's $7.99 per month. So typically this costs the customer $8 per month. They get it for free on that $60 plan. So if you're bundling with protection, you're paying $67 a month, they're actually getting an extra $8 of value on there. So that bill should be what? $84, $85 per month, but they're getting it for $74, $75 a month. They're getting it for $67 with protection included. So let's walk through a typical sick day, right? This is really going to show you the value of this product. Time is money, right? If I have to drive 2 hours to get somewhere, 2 hours to get back, I want to make sure I'm getting the most bang for my buck wherever I'm going. So time is money. On a typical sick day, if you wake up feeling awful, that's when the fun begins. You got to call your doctor, set an appointment to get in. It'll take you 30 minutes to get showered, to get ready for that appointment. Another 30 minutes to drive to the closest doctor's office that you have coverage with. You're going to be waiting 30 minutes in the doctor's waiting room, filling out the forms, waiting for them to call your name. 20 minutes in the examination room where they take your weight, get your blood pressure, and nurse asks you what your symptoms are again. Doctor comes in, 5 minutes for the doctor to diagnose your ailment. 30-minute drive to your local pharmacy to pick up your prescription. 10 minutes to drive back home. So that's about 2.5 hours is a typical visit to the doctor on a sick day. Now, here is the K Health alternative, which is fantastic. You're not feeling good. You wake up. You're feeling awful. You open the app. You chat with the AI interface to describe your symptoms. You can get a prescription ordered to your local pharmacy, all done in 20 minutes. Just go pick it up. You're good to go. Sounds too good to be true, but it is true. 10,000 5-star reviews. This is awesome. It's revolutionary. It is a game changer, only available for Boost Mobile customers. So the benefits of K Health, again, forget the long lines to your doctor's offices. It's available whenever you need it, 24/7, even on weekends and holidays, as I said before. Children ages 3 to 17 are covered. It also includes unlimited follow-ups, prescriptions, and refills right from your phone. The affordable piece of this is huge. When you talk to your customers, this is huge. No insurance required. No expensive copays. You will get discounted prescriptions. And again, it is free on a $60 unlimited plan plus or $7.99 on a $50 plan. So what does it look like? So you're going to have the app, which we'll get into in just a second. We're going to show the card to your pharmacist and ask them to check the RX Saver discount price in addition to your insurance, if you have insurance, to get you the lowest price on your prescriptions. And you're going to select the option that gives you that lowest priced route for you to take, right? So the K Health card is not a insurance card. It's not combined with your insurance. It's kind of an either or. Is the K Health RX Saver program better than your insurance? It could be, depends on who your insurance is. Or if you don't have insurance, absolutely it is. So this is totally comprehensive. It's totally personalized to each individual. Every clinician on here that will be responding to your customers are board certified. It doesn't just cover coughs and sniffles, right? It's over 400 plus conditions, from pediatric care to tooth infections to diabetes treatments. No more looking at WebMD or Dr. Google, right? Going there, what's wrong with me? And you Google it, and oh no, I have I'm going to die in 5 days. You know, the crazy stuff that would make you paranoid. No more guessing, no more doing any of that stuff. You can get to a doctor right away, quick and easy. So how do we get started on this, right? So you're going to provide the customers with a sheet from the TerraPad or buck slip to set the expectations, your next steps or timelines that should be shipped to your stores. Now the key here is waiting for the text. Do not download K-Health from your app store. You'll get a text within 48 hours of your activation with a special downloaded link. The text is going to guide you through downloading the app and setting up your personal K-Health account. You do have to be 18 or older in order to have this app and talk to the doctors, obviously. But again, it does cover children or dependents ages 3 to 17. So what's going to happen is you'll get the step that they have to download the app from the Play Store or Apple Store, but wait until you get the text message to download it. And this is what the text message looks like for those of you in front of your computer. Again, you'll get the message. Unlike your K-Health benefits are already included in your Boost plan, activate 24/7 access to doctors for you and your kids 3 and older, and then you'll see the link. So once you get that link, you're going to click on it, and that text is going to guide you through downloading the app as well, instructing you on how to set up your personalized account. Easy peasy, right? It's that simple. You're on your way to that convenient health management right from your mobile phone. So this is awesome, man. I like it. I love it. What does this look like when you're actually talking to it? So the AI interactions. So you go in there, you talk to what your symptoms are. So in this example, the customer came in and said they had some symptoms, whatever it may have been. Maybe it burned a little bit when they went to the bathroom. It says here, based on what you told me, and 419,326 cases like yours, looks like you have a UTI, urinary tract infection. I'm going to connect you to a doctor to prescribe you antibiotics. So then you reply back, okay, thank you. And then you're going to get a doctor reach out to you. So in this example, it was Dr. Ermani Hemphill. So hi, Dr. Hemphill, sorry to hear you're not feeling well. I'm going to send a prescription for Macrobid to your pharmacy. Take as directed and reach out if you have any questions. So bing, bang, boom. You give your symptoms in, you tell them what's going on. They diagnose it. They get you to a doctor. The doctor will then prescribe your medicine. You can just go pick up. Nice and easy. If you have any questions, obviously you can reach out. Again, this is 24/7, 365. So in your sales pitch, think about what questions we're already asking that can help identify K-Health opportunities. So when you're talking to your customers, who's part of your household? We're looking for family plans to add line opportunities, right? So if you have a family plan or they have 2 or 3 kids, boom, they're going to want their $6 plan because now those kids, how old are they? You know, if they're older than 3, between 3 and 17, they're going to be covered on this. So it's going to benefit not only you as the adult, but it's going to cover dependent children as well. Do you get free Wi-Fi internet as part of your stimulus package? This is another qualifying question, right? So we want to continue to push EBB, very important. Do you get free Wi-Fi internet as part of the stimulus package yet? Oh, no, what's that? Oh, do you by chance have SNAP or Medicaid? If you do, there's a chance you can qualify for our emergency broadband benefit program, which is going to give you 35 gigs of internet every single month for 6 months to a year. And on top of that, if you're underinsured or if you have a high deductible, you're going to benefit from the convenience of K-Health on our Unlimited Plus plan, right? So you want to bundle all this stuff together. Obviously, when you're qualifying, you want to check their coverage, right? So if they're in a rural area, you can ask them, what's your proximity to a major city or health services? How far do you have to drive to go to the doctor? Oh, you know, so it's 45 minutes or it's 30 minutes. Well, guess what? It's going to save you that long drive for medical attention because it is now at the power of your fingers. So really, really important. We want to make sure you guys are leveraging this. Again, we're talking the $60 plan, the Unlimited Plus plan, but you can get this on your $50 plan as well, but it is a $7.99 add-on. So let's look at the total pitch, right? The $67 pitch. This is what I'm pitching all day, every day to customers in my store. So any customer who uses Hulu, Netflix, Vudu, I'm already thinking $60 plan, right? Because I want to make sure that they have high def streaming. But I'm not thinking 60, I'm thinking 67 because I am always going to bundle in Boost Shield to my activations. So based on what you told me, Mr. and Mrs. Customer, I recommend our $67 Unlimited Plus plan. This will provide you This will provide you comprehensive protection on your phone, personal information, and your family health. So the breakdown on what you get for that, your $6 plan, $7 for your Boost Shield, your protection. Don't ever call it insurance. It's the power of words you use. People don't want to pay for insurance, but they do want to have their phone protected. So unlimited talk, text, data plus protection. Your high definition video streaming is included. You're going to have 30 gigabyte hotspot, and you're going to have K Health, so you can have access to doctors and prescriptions at your fingertips, and it's only $67 per month, right? Awesome, awesome plan. You guys should be selling this all day, because not only is the K Health big, remember, UPP, Unlimited Plan Plus, is a priority for us now to be selling. So we need to ensure we increase our capture rate. That is more profitable for your guys' stores and more benefits for your customers. So on the 2 for 90 pitch, right? So if you go 2 for 90, now this example does not have the protection bundled in. So I would actually pitch this as 2 for 104, right? Because I want protection on both plans. But if you talk to a customer, maybe it's a mom and her daughter. And the mom watches Netflix on her phone. Okay, no problem. For only $104 a month, you're gonna have unlimited talk, text, data. You'll have high definition video on your phone. You're gonna have that 30 gigabyte hotspot included in K Health. So for your daughter's line, which is only that $30 extra or $37 extra per line for unlimited talk, text, data plus protection, you can make sure that she is covered. You can help with their appointments and refills. And it's only cost you $104 per month, right? Or if you took protection off, $90 a month. And so notice what's going on here is if you get the $6 plan for line 1, you don't necessarily have to do the $40 add-on for line 2. That $40 add-on would give you everything that's on a $60 plan. So you get the high def streaming, the 30 gigabyte hotspot. But if it's a kid's phone, maybe they don't want to pay that extra money there. You can do that $30 add-on. It basically is everything that comes with our $50 plan currently. So unlimited talk, text, video, and 12 gig hotspot. So in this example, Mr. and Mrs. Customer, based on what you told me, I recommend to you our 2 for 90 plan. This will give you high definition video and 30 gigabyte hotspot on your primary line, plus unlimited access to K Health for you and your children. This means no more waits for doctor's appointments or expensive insurance deductibles. You can access the care you need right from the comfort of your home. All right, so add-on lines are important for us as well. It's one of our other priorities in our pyramid. So Unlimited Plan Plus, yes. Value-added services, yes. Add-on lines, yes. EBB, yes. So you guys have a lot to offer your customers and really a lot of great values. If you think about it, we're giving them internet 6 months to a free with EBB, right? Just buy $25 for the device and you get 35 gigs of hotspot every single month. That's a $50 value. And now we're giving them K Health an $8 value totally free on our $60 plan. Now, again, on the $50 plan, you can still add it, so you can pitch it as needed for customers who maybe they're getting a one-line deal and say they're on a $50 plan, so it'd be $58 if they want to bolt on K Health, and then an extra $7 if they want K Health plus protection. But here's the thing, if you look at the math on this, right? Think about putting K Health on a $50 plan. Monthly cost is $50. K Health is $70.99. Your total charge there is $57.99. So for $2 more, you get your high definition video streaming, and you go from 12 gigs of hotspot to 30 gigs of hotspot. So I'm not going to sell many of these $50 plans with K Health. I'm going to bump it up to the $60 plan. So no matter what pitch you guys use, make sure you always remind the customers before they leave the store that Boost Mobile is the only wireless company that will give them 24/7 access to a doctor with K Health. So the big summary, kind of the elevator pitch, is with K Health, you're going to get access to world-class clinicians who can diagnose, write prescriptions without patients stepping into the house or wherever you are, right? So it's right from your phone. You get your prescription sent, you can get diagnosed quick and easy at a very, very low cost. It's great for customers who don't have insurance. It's a huge win for those customers, which are a lot of our customers. All of our EBB customers probably don't have, the best insurance options, and K Health is there to supplement that with an extremely awesome promotion exclusive to Boost. All right, we still got some time left. Don't want you to hang up yet because we still have our special offer. But are there any questions so far on the Unlimited Plan Plus or K Health? All right, don't see any questions in the chat. So here is the exciting offer for you guys. Again, I'll send this deck to all your DCI account managers, but there's a star training out there, and you guys, as Boost employees, can get a 6-month K Health subscription for completely free. You simply have to take this star training. Now, this star training is not listed in star. You have to use the link included on this deck. And I know this they've shared this on local calls as well, but if you do not have it, it is included here. But if you take this star training from the link included right here, you're going to enter your phone number, your door ID, your email address, your star user ID in the enrollment form. That'll be sent to you in an email link, and you will then get 6 months of K Health subscription. So this is fantastic. The first list is going to be pulled on 8/20 for who's eligible for enrollment. So if you do it today, you may have, today's the 16th. You got 4 days before that first list goes out, and you'll get your link to go ahead and get signed up. So awesome news. We'll be able to interact with it. I'm signed up for it, waiting for my code so I can finalize it. I'll be testing out on my end. Would love for you guys to test it out as well, see what kind of experiences you guys have, and then be able to better help pitch it and position it to our customers. But I mean, it's awesome. I mean, this is, you can't beat free, right? And our $60 plan is already has so much great stuff with it. The addition of K Health is a kind of a game changer, really, for our customers, because no one else has this but us. All right, so I know I'm a couple minutes early, but that is all I have for today. I want to thank you guys very much for your time. And again, if there are any questions, ask now. Otherwise, I will chat with you next week.